But we're going to start this program with another problem that's caused by your nervous system, kind of when your nervous system runs amok. It's called persistent pain. Real and sometimes severe pain that you feel long after an injury has healed. So I want to welcome to the program physical therapist Josh Butcher from Indiana Physical Therapy. Good to have you here.
Thank you. Thank you.
And you WOWO listeners are all going to be wondering it now. Josh Butcher, could that be the famous Charlie Butcher's son?
Right.
And in fact, it is.
That's right. That's my dad. He's a legend here.
Man, isn't he, though? I worked with your dad in Muncie. My wife worked with him at a radio station here. We knew him, and what a big loss for everyone, and I'm sure your family as well. So I'm glad to have you here. All right, so let's talk about this persistent pain. Now, let me get this straight. This is after I've had an injury and my tissues have healed, the pain continues, right?
Yeah, so we see a good deal of patients that, don't fit the normal, hey, I just had this acute injury. It's very mechanical in nature, makes sense. And, we do this, we do a little exercise, a little hands-on stuff. You get better, the swelling goes down, the inflammation goes down, pain goes down, back to normal life. I mean, that's what we mostly see. Mm-hmm. But there's a good deal of folks that, it's why is this pain lasting? Why is it spreading? Why is it limiting my activities more and more and more? No one can seem to help. I can't get any answers. And they come to us lost, and we have to figure out, well, what all is going on? Because it's likely not just a structural issue. Our nervous system is super complex, and there's a lot that goes into the sensitivity of that nervous system and what that means for their painful experience.
And so your brain has essentially learned a new way to interpret sensations from the body.
Yeah, absolutely. So the way I like to describe it to patients is kind of like this alarm system. So, you got this electrical activity running through your body, communicating to your brain and your nerves all day long. Okay, and then let's say you step in a hole and you sprain your ankle. We got this huge spike in that electrical activity, and now it's above this threshold where now it tells us we're having pain, we need to change our environment. So that comes down over time. We got to kind of walk differently, not put weight on it the same way, and hope that we get back to living in that low area, not even close to that line. But what happens with some people is, let's say they keep working through an injury, and they keep staying at that line. They have a couple good days, then they have this high stress, and they're worried about it, and they keep hitting that threshold, and it's hard to come back down. So we have to kind of turn that volume down of the nerve sensitivity. So everybody has these Ring doorbells, including myself. Mm-hmm. And at first it was so annoying because it just kept notifying my phone every time a car drove by, a mile away. Right. It's notify me when there's someone right up at my door, and so that's just turning down that sensitivity of the nervous system. I think has a lot to do with that painful experience and how we can treat those kind of tricky patients.
That's a really good way to think about it. That Ring system makes a lot of sense to me. You just got to get it adjusted, get it dialed back. Right. So it's warning you when you need to be warned, right. Not all the time.
Yeah.
And so that's what's happened. Your nervous system is now on hyper alert in every little input. So normal motion, things that you want to be able to do, result in pain that really you shouldn't have to be suffering. I get it.
Correct.
So give me an example. Tell me about a recent case and how it presented and how you worked it out.
Yeah, so there's a little bit of this in everybody, I think, and we dive into stress and sleep and some other things that can kind of go into the painful experience. But if I think about one of the more complex cases recently, had a guy he was in the military, and 3 years ago he stepped in a hole and he had this hip pain and this leg pain, and he just had to keep working through it. He never really got a chance to recover from it and rest and modify his activities like you should to turn that volume down. And there's a lot of stress going on. I think he, had a couple of kids and changed jobs once he's out of the military, and went to all these different providers. And before you know it, it wasn't this well-explained mechanical injury that followed a specific pattern. It was, widespread pain that's now on both sides of his back, and he doesn't describe it as shooting down, but shooting up, and tingling in his foot, and just all these symptoms after 3 years of the injury is probably healed, but his nervous system is just going haywire. And so we have to really use some interesting strategies with him. and open up the door to the fact that, that little disc bulge that they showed on MRI, that might not be explaining the whole picture. Certainly that probably has something to do with it. I'm not going to deny that. But, let's talk about your stress, your sleep, your diet, what you're doing, what you're afraid to do, how it affects your life as a whole, and use some different strategies that we can talk about that are different than kind of traditional, exercise and manual therapy and massage.
So let's walk through some of that. What do you do for a guy like that?
So I think one of the great things about being a physical therapist is that I get to spend hours and hours with my patient and really learn about what makes them tick and what's going on in their life. So I think some of it is just, with him, was explaining, hey, there might be some other things going on here, and you can't just throw it at them on day one, or they're just like, nope, like, this guy's crazy. So
right, don't tell me it's in my head.
Right, exactly. And I'm never saying that, but to explain how complex pain is to someone is foreign, but can help them, feel like, oh, you know what, maybe there are some other things that I can do to help with it. So, with some patients, all they need is simple graded exposure to activity. Hey, I cannot run a half a mile before that pain in my leg, starts to go crazy. So we have to break down running into different exercises and build up to that. And you're going to run a half mile, or a quarter mile this day, and 0.3 of a mile the next day, and really go slow. And that's a big part of what we do. But there's some other kind of unique things we do with, such as like discriminatory training, where his lower back, like, he didn't know where I was pressing anymore. Just tiny bit of pressure. He wants to jump off the table. That's not normal. There's no bruising there. There's no skin injury.
Yeah.
Your nervous system is telling you, take your hand off the stove, but that's not the threat that's actually there. So we'll do some really unique things, like draw a grid of 9 areas on his lower back, and we have to practice, where am I touching? And he gets better as sessions go on, because what I think's going on is, in his brain, it's all the map of where everything is and what's painful is very smudged and not clear, and we have to redefine those areas. Let me be clear, this is a very small percentage of what I do for work. This is not the normal patient, but we do get these cases where we have to be creative, and there's some great research for some of these things. There's some patients that can't even discriminate anymore if they look at pictures of what's a right hand or what's a left hand. And to know how complex pain is, you just have to think about, I'm sure you've heard of, phantom limb syndrome.
Yeah.
A patient has pain in a hand that's no longer there.
Right.
Just knowing that tells you how complex pain is. And there's things like mirror box training, where the patient will, open and close their good hand with a mirror in between, and they will be imagining that that's what's going on in the limb that's not there. And it can be very, very helpful with their pain processing. And it's just like, it's so over people's head, but there's other things out there to do for your pain other than just blame it on some structure and you need surgery, or it is what it is. There's other stuff there that's at play.
Before the break, we were talking a little bit about a patient that you've been working with this problem. How's he doing?
This guy I've been seeing for, 2-3 months. It's been a long time, and it's not just some drastic result. I don't just crack his back and now there's no leg pain and he's good to go. I don't believe that necessarily exists in a lot of situations, but certainly his function has started to progress. He has good days and bad days, but the line is not linear. It goes up and down, but it's trending up. His pain is also the same thing. It's not linear, but it's trending down. And so, I tell him, don't think about day to day. Think about every 2 weeks or every month. Are you doing better than then? Yeah, I'm back to the gym. He's playing paintball now. He's going for a mile run. Sure, he has to stop due to pain, but he wasn't even willing to do those things at first. And so it's a slow process. And he was very open to some of these other things we talked about stress and sleep and diet, and just now has a new optimistic look and noticing that some of these things are helping when he starts to have a flare-up, knowing this is not going to be the end of the road. It's gonna come back again. I'm gonna have some better days, and finding strategies that help him along the way that are not just physical exercise, massage, that kind of stuff, but more like mindfulness and some meditation and some diet and some sleep hygiene.
Thinking about pain in a different way sounds like an important solution here for these folks.
Absolutely.
And you've used a word a couple of times in conversation off air, catastrophizing. Tell me how that plays in.
Oh, that's huge. I mean, one of the most important things I think I or us as physical therapists do for folks is tell them it's going to be okay. Now, if there's a lot of red flags, things that we really are concerned about, we're going to give them the appropriate referral to someone for more imaging or another consultation. But a lot of folks have never had an injury. They don't know what to do with the painful experience that they're having. And when we bring them in and we say, this is going well for you, you don't have this weakness, you don't have this, you don't have that, this is something we've seen before, it's going to be all right. They're better, right? Just from that conversation, they're a lot better. Yeah. So if we could get ahead of the game and see some people before they get into the system and everything's over medicalized and they're on opioids and they're signed up for surgery and they got a bulging disc problem and all this stuff, and tell them, hey, let's try some conservative measures. Let's get you moving better, feeling better in a variety of ways. We could save a lot of people from going down into the chronic pain, persistent pain, cycle.
Oh, that sounds great. I'd love to avoid all that mess. And a big step toward getting there is something you just mentioned, sleep hygiene. What's the connection between sleep and pain?
There's a big connection between sleep and pain that we found, and one of the studies that really stands out to me, I don't have the name of it on me, but I can get it for anybody that knows, is they took a big group of people and they would measure pain pressure threshold. So they use a device and it pushes out a certain pressure, and the person would tell the examiner when they thought it was painful. So they're getting some numbers on this. And they're looking at people who have good sleep quality versus sleep-deprived people. And overwhelmingly, the sleep-deprived individuals recognize that pressure as painful at a much lower number. So there's a huge increase in your nervous system sensitivity when there's poor sleep quality.
And what do you teach me about sleeping? That sounds like an odd thing for a physical therapist to want to talk to me about.
Absolutely, and it's not what I do every single day with every single patient. Absolutely not. This is really reserved for when our normal measures aren't working. It's unexplained. It's not just the normal mechanical low back pain we see. Here's what we usually do, and you'll be better in no time. This is when things aren't adding up, things persist, and we have to start exploring some other parts of this. It'd be nice to, I give some pamphlets out to people that say that they're just not sleeping well because I know what it does for pain. But sleep hygiene, there's a lot that goes into it. The biggest two are a schedule. Going to bed at the same time, waking up at the same time every day really helps for your circadian rhythm and just your homeostasis. So weekday, weekend, not really changing that up is known to be helpful. Also, 7 to 9 hours. I mean, a lot of people know that. That's kind of what the American Academy of Health of Sleep Medicine recommends. And avoiding naps during the day, trying to keep the bedroom for sleep and sex only, not work and TV. We talk about screen time, and the iPhones have the different light now for nighttime. Having a routine. And there's other things that we can go on for the person that's really painful. Meditation. There's apps for like Headspace, where you can meditate before bed and have this routine to relax before bed.
Yeah. A big believer in all that stuff. I monitor sleep with an app that I use all the time, and I really thought I was a lousy sleeper until the app is telling me, no, you're doing pretty well. And funny, I feel better now.
Yeah,
it's
right.
Funny how that works.
Yeah, we can use those apps just to detect if they're having good quality, because the 7 to 9 hours, it doesn't equal good quality.
Correct.
And that can identify that, and then we can start talking about hygiene to maybe help with that.
Yeah, you bet. Stress management. More stress, you feel more pain. Is that correct?
Oh yeah. I mean, it just goes back to that sensitive nervous system. If that stressful response in your body is going on over and over and over again, it hikes up that threshold. We talked about that alarm system is just kind of waiting to happen at all times. And it just goes back and forth. Pain causes stress causes more pain. Pain causes poor sleep causes more pain. It's this vicious cycle. And so if we can talk about some of the triggers for stress, some of the good sleep hygiene topics, that can help bring down that line and decrease the sensitivity.
And so I get the vicious cycle nature of all of this, because one of the most effective ways to sleep better and to reduce stress is exercise. But if you're feeling pain, you don't want to get off the couch. So I get it. You kind of got to get locked into that cycle.
Exercise is kind of the answer for a lot of different problems in your whole being and system. And movement and exercise is what we do. That's the basis of what we do as physical therapists.
Yeah, isn't that interesting? interesting. So you are teaching the brain and the body to react differently to stimulus, and you're doing that through sort of a desensitization process?
That is one big thing we do, desensitization, and that's through exercise, that's through hands-on therapy. I mean, there's lots of ways to desensitize the nervous system. It's an interesting concept, but that is kind of the basis of what we do with almost every patient.
Give me an example of how you might apply that. What type of desensitization are we talking about?
We can talk about an exercise term, so graded exposure to activity, getting that person that can't vacuum for 10 minutes up to that activity and telling their nervous system it's okay to move again. A lot of times, like after someone's been in like a walking boot or immobilized for a long time, they do not know how to move their foot. They feel that threat of pain when they try to, and you have to desensitize that joint and the muscles and the nerves through movement and exercise. And then, same thing with my patient that, he could barely touch me, flies off the table. Through massage and joint mobilizations, you just tell that nervous system, hey, it's okay to be moved around a little bit, to push here, to push there, to turn you this way, turn you that way. And over time, it calms down, and that ring doorbell, and now it's only when the person's right there. It's not when they're a mile away.
We have just a little bit of time left. What do you want people to know about working with a physical therapist?
I think people need to know that we do more than just, give you an exercise program. We do more than just, crack your back or massage, your neck. I mean, we get to see you for hours on end and consult with you about a variety of issues and help you through the painful experience. It's not as easy as you have this structure that's causing pain, you need this surgery or treatment. It's very complex, and we're here to guide you to navigate through that whole situation.
All right. Josh Butcher is with Indiana Physical Therapy. They have 7 locations in Fort Wayne. They have 11 locations throughout northeastern Indiana. So they have 1 on the south side of Indianapolis. So no matter where you are, they're not far away, and you can reach them. Their central scheduling number is 209-2464, and you can find them online at indianapt.com. That's indianapt.com to reach Indiana Physical Therapy. And there, if you need the help, Josh Butcher can help you with persistent pain. Thanks. Good to see you.
Thanks a lot.
Glad you were here.